Hey girl. All right, so we're gonna move from your hips all the way up your back. What you'll need for this is going to be a small ball, lacrosse ball, tennis ball, and then a long foam roller and a theracane. So let's start with your piriformis. You're going to find the greater trochanter of your femur, and you're going to put the ball slightly behind that, and then you're going to pin the muscle up against it. So make sure that you are starting in a position where your shoulders and your hips are pointing straight forward, but then you are going to rotate, dropping your knee towards the ground of the side that the ball's on. Once you find that ooh-ah spot, I want you to gently push your knee forward and then bring it back to the starting position, as so. Doing your best to take big deep breaths, trying to stay relaxed, trying to keep your shoulders down, your jaw unclenched. I know that's hard. Move over to the other side when you're ready. Note differences from side to side. That can save you time in the future if one isn't typically tight. That might mean that you don't necessarily have to spend a lot of time there. So, again, big deep breaths. Trying not to draw in towards your center, trying not to cringe and, want to roll your shoulders in. I know that that's the kind of the standard when something hurts. So once you're done with the ball, you're going to stretch this muscle out by laying flat on your back. You're going to pull your opposite knee towards you while you are pushing the intended side, so in this instance, my left side, forward in the opposite direction, pushing it further into external rotation. Do this on both sides or whichever side is in fact sore. If they're both sore, always both sides. Do this for a period of anywhere from 3 to 4 breaths, making sure that you are breathing in fully into your belly, and then that forceful exhale is going to help to increase all of the tension that is helping to stretch this muscle out. All right, next we're going to grab our theracane, and I want to do your QL, your quadratus lumborum on either side. Again, noting differences from side to side. What you're going to do to ensure that you are doing the right muscle is I want you to stay outside of your erector spinae, but you are going to push in towards your midline. So you're going to pull the cane forward, but also laterally, so you're pulling it towards your spine. But then again, steer clear of positioning the theracane like on your spine. So let me see. Am I going to show you what it looks like from the other angle? Yes. Okay. So pulling forward, but then using this the arm of the same side you're doing to push in towards your midline. All right. Now moving on up, grab your long foam roller. When you are rolling your back, you're going to keep everything maintained within the area where your ribs are, your rib cage. So you're not going to roll your lumbar spine. I want you to go from the bottom of your rib cage all the way up to the top of your shoulders, noting places of discomfort. Typically speaking, this feels pretty good. Anyway, I want you to make sure that you keep your core tight, your abs flexed, and sometimes it's even beneficial to roll your pelvis into more of a posteriorly tilted position, which increases just like the crunch in your abs and everything. And then hug yourself tight to pop all the muscles out. After that, we're going to move to lats and mid-back, raising your arm up. It's helpful to do small forward and backward sweeping motions. It's just going to help to stretch out those muscles that are tight. Remain on all tender spots for, again, the duration of 3 to 4 breaths. Just big, deep breaths. Once you have done both of your lats, I want you to then stretch your thoracic spine out. So again, it's important to keep your abs crunched, your core tight. And all of this movement, or at least the majority of this movement, I want to be coming actually from your thoracic spine, not so much from your lumbar spine. So what you're going to do is you're going to put your arms on this position, and I want you to move your shoulders up towards the ceiling. I'm sorry, not your shoulders, your elbows up towards the ceiling without actually moving your shoulder joints. Then place the foam roller vertically and lay down, keeping the foam roller in the channel where your spine is. You're going to keep your core tight. Try not to overly arch your back. And then we're going to do various arm motions. So we'll start with, I like to call these angels. Making sure to pinch the foam roller the whole time. Drawing your elbows down close to your sides. And then we will flex and extend the shoulder joint. Internal and external rotation. Getting all the good spots.